Senna Plus is a medication used to relieve constipation. It contains two medications, Sennosides and Docusate. Sennosides are stimulant laxatives that work by retaining water in the intestines to promote bowel movement. Docusate is a stool softener that helps to increase the water content in the stool, making it softer and easier to pass. It is important to follow the recommended dosage and take Senna Plus at the optimal time for best results. When taking Senna Plus, it's important to take it with a full glass of water as directed by your doctor or as indicated on the product package if you are self-treating. Make sure to not exceed the recommended dosage and do not take this medication for more than 7 days unless directed by your doctor. It may take 6 to 12 hours for this medication to cause a bowel movement. If your condition persists or worsens, or if you experience rectal bleeding, seek medical attention immediately. Some common side effects of Senna Plus may include stomach/abdominal pain, cramping, nausea, diarrhea, or weakness. However, these effects are usually not serious and may go away on their own. This medication may also cause your urine to turn reddish-brown, but this is harmless and will go away when you stop taking the medication. If your doctor has prescribed Senna Plus for you, it means that they believe the benefits of taking it outweigh the potential risks of side effects. Most people who use this medication do not experience serious side effects. However, if you do notice any serious side effects such as persistent nausea, vomiting, diarrhea, muscle cramps, irregular heartbeat, dizziness, decreased urination, or changes in mental/mood, be sure to tell your doctor right away. While it is rare, a very serious allergic reaction to Senna Plus can occur. If you notice symptoms like rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects, so if you notice any other effects that are not listed here, be sure to contact your doctor or pharmacist. If you have concerns about side effects, it is always best to talk to your healthcare provider for more information. Before taking Senna Plus, it's important to let your doctor or pharmacist know if you are allergic to Senna, Sennosides, or Docusate or if you have any other allergies. This product may contain inactive ingredients that can cause allergic reactions or other problems, so it's important to talk to your pharmacist for more details. It's also crucial to inform your doctor or pharmacist about your medical history, especially if you have had appendicitis or symptoms of appendicitis, a sudden change in bowel habits that lasts for longer than 2 weeks, bleeding from the rectum, or intestinal blockage. If you are planning to have surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Additionally, if you are pregnant, it's important to consult your doctor before using this medication, as using it for long periods during pregnancy is not recommended. If you are breastfeeding, this medication does pass into breast milk, but it is unlikely to harm a nursing infant. However, it's still important to consult your doctor before breastfeeding while using Senna Plus. When taking Senna Plus, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with Senna Plus is mineral oil. If someone has taken too much Senna Plus and has serious symptoms like passing out or difficulty breathing, it is important to seek medical help immediately. You can call 911 or your local poison control center for assistance. Symptoms of an overdose may include ongoing nausea, vomiting, or diarrhea, as well as severe stomach pain or cramping. Make sure to attend all your medical and lab appointments as directed by your doctor. In addition to taking Senna Plus, you can also make some lifestyle changes to help prevent or relieve constipation. This includes exercising regularly, staying hydrated by drinking enough water, and maintaining a proper diet with fiber-rich foods like bran, fresh fruits, and vegetables. If you have any questions about how to make these lifestyle changes, be sure to talk to your doctor or pharmacist for personalized advice. If you are taking Senna Plus on a regular schedule and happen to miss a dose, take it as soon as you remember. However, if it is close to the time of your next dose, it's best to skip the missed dose and take the next one at the regular time. Avoid doubling the dose to make up for the missed one. Make sure to check the product package for specific instructions on how to store your brand of Senna Plus, or ask your pharmacist. It's important to keep all medications out of reach of children and pets. Do not flush Senna Plus down the toilet or pour it into a drain unless instructed to do so. When Senna Plus is expired or no longer needed, be sure to properly discard the product. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.